Hello, everyone, and welcome to the Healthy Living Livestream. I'm your host, Dr. Andrew Kaufman, and today we're going to be talking about coffee. Is it healthy? Well, we'll certainly find out. But first, let me tell you about a great opportunity because every month I do an in-depth masterclass on a topic of interest to you, and many of the topics that you've seen on the live stream come from that material where I go in depth and do research. And this all happens inside my True Living Fellowship, which has open enrollment right now. And in fact, this Thursday, I'll be giving a masterclass on the father's role in the birthing process. So we'll talk about dads and having babies. And I think it'll be very informative based on my experience of 3 children, all born at home. So please check out that. You can join with no long-term commitment, and it's open right now, the True Living Fellowship. All right, back to today's topic of coffee. Well, let's begin by discussing a little bit the history of coffee, which is said to come from Africa and was around the 15th century, made its way over to the Middle East and was cultivated in Yemen as a drink that was stimulating. And coffee shops in the Middle East began to sprout up. And these were 2 centuries ahead of the European exposure to coffee. And this is why the beans are named Arabica beans. And eventually in the 16th and 17th century, mostly, coffee spread into Europe, where it was quickly adopted and even sanctioned by the Pope, who was expected to ban it, as many of the Muslim leaders tried to ban coffee in the Middle East, but it was too successful to overcome and was a great alternative to alcohol, which was banned by Islam. Now, in Europe, it also began to replace alcohol as the drink that people would prefer throughout the day, and the coffee shops began to sprout up, just like the one in this image. If you could bring that image up. So this is a 17th century coffee shop in England, and it does resemble a little bit a Starbucks. But we can see that these had the reputation of being places for mental stimulation and intellectual discussion. And in fact, some authors attribute the Renaissance to the spread of coffee replacing alcohol as the common beverage. Now, if we fast forward to modern times, when I was growing up and when many doctors have been trained in the last century, we were taught that coffee is harmful to the health, that it can cause heart problems, high blood pressure, that it's an addictive stimulant of caffeine in it, et cetera, et cetera. And I came across in my research this video that I'm going to play a clip from. And this is Professor Tim Spector, who is one of the most cited published researchers. And let me first tell you that I don't agree with much of his research, because the same mistakes that he's admitting to in this clip, he's still making without reviewing some of the primary evidence and techniques that he's using. However, he is well respected. And in this clip, he's talking about how when he was training as a physician, he was told things about coffee and even published research that later on turned out to be, in his words, rubbish. So let's take a quick look.
I was brought up through medical school and as a junior doctor to really warn people off coffee, that it was bad for you. It was a stimulant that overexcited your heart, and that was probably a cause of heart disease and heart failure, heart attacks, and particular abnormal rhythms of the heart. So, and I actually it was also linked to cancer and other things in the 1980s. And I even wrote a paper on it myself, saying that coffee caused cancer of the pancreas, which was very good for my career, but was total rubbish. in retrospect, as much of epidemiology. Yeah, so it's only really, I think, the last 5 years that the evidence has really accumulated so much that it's incontrovertible that the studies are showing that coffee drinkers have less heart disease than non-coffee drinkers. And there's certainly no excess in cancers or mortality to suggest there was any real bad effects.
Well, that was a very enlightening clip. And first, let me clarify the record that the evidence of coffee's health benefits go back much further than the past 5 years. And you can see studies published really over the last 40 years, at least, all extolling the health benefits, which I will get to. But I think this is a very important admission of a professor, a published researcher, one of the top researchers in terms of being referenced in the literature, who admits that a study he published was good for his career, but was complete rubbish scientifically. And he even said that all epidemiology is rubbish, essentially. And this is something, of course, that came up a lot over the past 3 years, when the only evidence available to support the narrative was epidemiologic evidence. So just now, I think it's much less difficult to imagine how much of the published research can be completely false when you have top researchers admitting that they published erroneous data and conclusions. So let's look at what the data actually shows. And if we go to the next slide, this is a review paper from the New England Journal of Medicine. And I'll just read the quote: "A large body of evidence suggests that consumption of caffeinated coffee, the main source of caffeine intake in adults in the United States, does not increase the risk of cardiovascular diseases and cancers. In fact, consumption of 3 to 5 standard cups of coffee daily has been consistently associated with a reduced risk of severe chronic diseases." And they have a nice little diagram here that breaks it down by body system. And you can see that in the brain, the evidence shows it increases mental performance and vigilance owing to greater alertness, contributes to insomnia, and induces anxiety. Now, this is something that only some people are susceptible to. And if you've tried coffee or caffeinated beverages, you know who you are. And for those people, it's important not to drink it later in the day and to have reduced amounts if they prefer to drink it at all. But this is certainly not present in the majority of people. In fact, I can have a cup of coffee or even 2 after a meal in the evening and have no difficulty falling asleep. Now, here they say it may reduce the risk of depression, and I'm going to present a very informative study related to that a little later on, and may reduce the risk of Parkinson's disease. Now, in cardiovascular, there is a short-term effect of increased blood pressure, but over time, actually, it's shown to reduce blood pressure as well as various other cardiac events. In the lungs, it slightly improves lung function in adults and is effective for treating apnea of prematurity in premature infants. The liver is very impressive, may reduce the risk of liver fibrosis, cirrhosis, and cancer, and we'll see more data on that. But in the meantime, let's go to the next slide, which this is by far the most important outcome when you're looking at the benefits or the toxicity of a specific intervention or substance. And here we have a meta-analysis looking at all-cause mortality. So that means, did it contribute to people dying by any cause whatsoever? And I will read the highlighted portion. Moderate coffee consumption, 2 to 4 cups a day, which is what we read from the previous study as well, was associated with reduced all-cause and cause-specific mortality compared to no coffee consumption. So in other words, in the time period looked at, people were less likely to die all across the board if they drank 2 to 4 cups of coffee a day. And let's look at a couple of figures from this paper to analyze it more carefully. So in the next slide, we can see the graph on the top represents the relative risk of mortality on the y-axis, and on the x-axis, the number of cups of coffee consumed daily. And that we can see here that the relative risk of dying goes down precipitously when we go from 0 to about 2.5 to 3 cups. And then it kind of levels off. And if we really drink a lot of coffee, like more than 6 cups, that's when the risk starts to go up again. But notice that the risk does not go up to the starting level. And we can see the dashed lines here is the 90%, 95% confidence interval. And you can see that in the graph, it never goes back up to 1, even the interval. So that means that all of these numbers are significant. And in the bottom below, it shows the p-value for this data, which is 0.0001, which is quite statistically significant. So this is a real effect. Now, if we look on the next slide, we can break it down to the cause-specific mortality. And we can see from the table on the left that if we just look at the 95% confidence intervals, which is in the third column, any of those ranges that go over 1 would be not a significant effect. So cancer, for example, and this is all cancers, it really doesn't make a difference for mortality. However, with some specific cancers, it has shown to have a mortality benefit. But if we look at diabetes, you can see that none of those intervals are across 1. And in fact, it looks like drinking the 2 to 4 cups a day may reduce your mortality from diabetes by almost 25%. Now, in the right, we have a similar graph to the all-cause mortality, and that's looking at cardiovascular disease mortality. So this is dying of cardiovascular disease, and we could see also a major decline in cardiovascular mortality drinking 2.5 to 3 cups, and then it levels off. So it looks like we have quite a number of health benefits from drinking between 2 and perhaps up to 6 cups of coffee a day. Now, it behooves us to look carefully at coffee's effect on the liver because of coffee enemas, which I will get to soon. But if we can take a peek at the next slide, and this is not the only review article looking at coffee's effect on the liver, but we can see from this quote, coffee appears to reduce risk of hepatocellular carcinoma, that's liver cancer. And that is the type of liver cancer that is associated with the fake hepatitis C. Reduce advancement of fibrotic disease in a variety of chronic liver diseases. So that is essentially cirrhosis. So it can dilute and perhaps reduce ability of hepatitis C virus, the imaginary virus, to replicate. This review aims to catalog the evidence for coffee as universally beneficial across a spectrum of chronic liver disease, and other papers and studies have echoed that result. Now, before we talk more about enemas, I want to mention something that came up when I was training in psychiatry at Duke. And that is that we were told there was a study that drinking coffee may reduce the suicide risk. Now, we were also told not to take this very seriously and start advising our patients with increased suicide risk to drink coffee, but it was quite compelling. And I did discuss it with some of the patients at the VA, which was interesting. But if we bring up the next slide, I found that there actually were at least 3 prospective studies. So these are one step better than retrospective epidemiology studies. These are prospective cohort studies, so not as good as a randomized control trial, but still reasonable quality of evidence. And what they did is they combined or looked at all 3 of these studies, and I'll read the highlighted portion. In the results, they had 277 deaths from suicide in a couple of 100,000 overall subjects, because suicide is relatively rare, but this is, certainly enough for these findings to be significant. So compared with those drinking less than or up to 1 cup of coffee, the ones drinking more than that had a relative risk of suicide that was only 55% of the people that drank less than 1 cup. And these were for folks drinking 2 to 3 cups. Now, the folks drinking more than 4 cups had a 53% reduction in suicide. So there is a little bit of a dose response relationship here, and the confidence intervals didn't come close to crossing 1 for this data, and the p-values were quite significant. So their conclusion is these results from 3 large cohorts support an association between caffeine consumption and lower risk of suicide. So this is the exact opposite of what's found with antidepressants, which are supposed to help people who are depressed and suicidal. But coffee actually has the data that it does this successfully. So perhaps if you're depressed, you might consider coffee before you go to the doctor for pharmaceuticals. So this evidence that I presented is really just a drop in the iceberg of what is out there. And some of these even include randomized controlled trials. So there is quite a lot of evidence in support of coffee, and very little that supports any negative or adverse effects, as long as you stay within this dose range of 2 to 4 cups of coffee per day. Now, in my natural healing research and experience, I've come across coffee enemas. And originally I learned about this from the Gerson Institute and the Gerson Protocol. And there is tons of evidence from their treatment that coffee enemas, along with juicing, can help many, many people cure themselves completely of cancer and other diseases. And of course, we saw all the health benefits related to liver disease. So coffee enemas are unique because we are delivering the healing substances in the coffee directly to the liver. And this occurs through veins in our colon that communicate directly with the liver in what's known as the hepatic portal circulatory system. And so these particular substances, and there are some that have been recognized as being important in this process, like cafestol and palmitate, have a variety of beneficial effects on the liver to help it further detoxify itself and improve and optimize its functioning. However, when we look at the literature, we cannot find any clinical studies or evidence whatsoever looking at the benefit of coffee enemas, even though from other sources we see tons and tons of evidence. But instead, we see papers like I'm going to show you on this next slide, which looks at the safety of self-administered coffee enemas. It really says nothing about the effectiveness because there are no published studies looking at that. But here, what they found is a total of 9 case reports where something bad happened and the patient happened to use a coffee enema, sometimes just a single coffee enema. Now, just in my True Living Fellowship community, I think there are more than 9 people doing coffee enemas at present, and there has not been one reported adverse effect. And I'll read what they say based on these 9 individuals. In regards to safety, based on acceptable quality of evidence, and these are all case reports, so that's very low quality. This systematic review revealed the risk of adverse events caused by the self-administration of coffee enema, which mostly include rectal burns and colitis. Now, many of these patients already had colitis, so it's kind of funny that they blame it on the coffee. And rectal burns, happen from someone not realizing that coffee is hot. And I don't think that this has anything to do with the practice of coffee enemas, because no matter what medical procedure we're talking about, somebody can make a mistake. Even with a routine injection, it can be accidentally injected into a blood vessel. The needle can hit the bone. So if someone is foolish enough to put steaming hot coffee, into their rectum, I think they essentially deserve what's coming to them, but we cannot blame the coffee enemas for this problem. Now, if we look at just colonic irrigation, also, which is similar to water enemas, there is more volume, and it's also similar to coffee enemas because we're essentially putting fluid into the colon to wash it out. On the next slide, there is an article published in 1932, because you'll also see almost no literature on enemas, other than perhaps for constipation. But here, this trial was done in a mental hospital for patients with schizophrenia, which they used to call dementia praecox, and psychotic depression. Now, these are two of the most difficult psychiatric illnesses to treat with modern treatment approaches. In fact, schizophrenia is universally said to be incurable and lifelong and just requires management. And psychotic depression is the most difficult form of depression to treat successfully and the most severe. So I'll read the quote here. After treating patients in each of these groups by colon irrigation, he reports that of his dementia praecox cases, 17% recovered. So almost 1/5 of people with schizophrenia recovered just from colonics. Of his psychotically depressed patients, 70% recovered. That's miraculous. And psychoneurosis, 80%. So that's anxiety. So of the total cases, all groups, 40% recovered, 33% improved, and 7% were released on visit. Now, this would blow away any mental institution today. Couldn't be anywhere near that, because they can't have these kinds of results and are unable to cure anyone with schizophrenia. So if we combine the health benefits of coffee with the health benefits of colonics, we should realize tremendous health improvement. And on my last slide here, I will highlight some of these issues. So if we look at the research on coffee enemas, there are no clinical studies published. The case reports talking about rectal burns are very misleading, and you can dissect that paper yourself. There are several editorials that claim it's useless and dangerous without actually any evidentiary basis. Enemas have been used for quite a long time historically, and time has honored their continued use. Coffee has been universally shown to benefit the liver. The chemicals can help dilate the bile ducts and allow stones and sludge to drain. And there's a reduction in fatty liver disease, cirrhosis, and hepatocellular cancer. And of course, we have the data of success from all of the Gerson therapy clients who have survived cancer and many other serious life-threatening health conditions. So all in all, we see that the story that we may have been told about the risks of coffee does not pan out in the actual research. And it really can be considered a health food, a health drink, or even a superfood of sorts for all those people who are not exquisitely sensitive to the stimulatory effects of caffeine. And sticking to between 2 and 6 cups a day will maximize all the potential health benefits without any risk of harm. So if you're a coffee drinker, or if you switched from coffee thinking it was not good for you to something else, now I think you have the evidence that it's okay to resume your coffee habit, and that most likely it will be beneficial for you. All right, Alexander, I'm sure that we have some questions on this topic. And I know that when I posted about coffee enemas previously, it was quite controversial. So let's see what people would like to know.
Yeah, sure. We were pondering what we were going to do if there was no coffee-related questions, but apparently we have an abundance now. So
Not
if you're
surprised.
ready. So let's go to the Adriana 1971. What coffee to use for coffee enemas?
Well, because Gerson Institute has the most experience, I would essentially rely on their information. And what they generally say is that it should be light or medium roast because some of the important chemicals in the coffee bean that would be therapeutic for coffee enemas may be diminished or degraded with darker roasting. So a light roast would be definitely recommended. There are many places, including the Gerson Institute shop, which sells Cafe Mam, enema coffee. Also, Alpha Vedic sells an excellent enema coffee, and there are many other choices out there as well.
Right. Let's go to not sunk yet. What negative effects, if any, does coffee have on the prefrontal cortex? Does it inhibit the function of the prefrontal cortex, or does it cause a state such as an alpha state?
Well, this is kind of an interesting question. So I'm not aware of any studies looking at the EEG effects. I know that many there are some studies looking at enhanced cognition and ability to focus and pay attention, although I wouldn't necessarily attribute that to the prefrontal cortex per se. So I'm not sure exactly how the brainwave state is affected, but certainly that would be something to look into. But performance on tasks is generally increased. In fact, even there's some data that there may be a small benefit for athletic performance from drinking a significant dose of coffee.
Right. Let's go to Jen. What causes some people to be hypersensitive to caffeine?
Well, I don't think anyone definitively knows the answer to this. There is a lot of speculation, of genetics and specific, enzymes that metabolize coffee. Caffeine, interestingly, is an insect repellent in the plants. So it's interesting that for us, it has, kind of a non-toxic effect, and the safety has been well studied. But there are some people, and I've worked with some people who have tried coffee enemas and had an excessive degree of stimulation. Even though there's not a lot of absorption of caffeine from the enema, there is some. So I really don't have the answer to that, unfortunately, and like I said, no one does. But if you are one of those people who are very sensitive, there is evidence of some of the same health benefits from drinking decaffeinated coffee, at least in terms of the gut microbes, which are associated with some of the metabolic benefits, such as diminishing insulin resistance. So it may be worthwhile to still drink some decaffeinated coffee if you are one of these people who are overly sensitive to caffeine.
Well,
Also, let me just point out that there are differences in the levels of caffeine from different coffees. So, for example, you have the Arabica beans and the Robusto beans, which are of a lower quality and less expensive, and those have significantly more caffeine. Also, depending on the way it's roasted and the way it's brewed, there may be more or less. So you can selectively shop for coffee beans that would have lower levels of caffeine, and you might tolerate those better.
I was just about to say that frees two birds with one key, because there were some questions regarding decaffeinated coffee as well. Let's go to Rocky Balboa. Or Rocky, does it matter if you add anything to your coffee, like milk or sugar? How important is the source, and does it need to be organic, low acid, etc.? Is mold also an issue? And you get the idea.
Yes. Well, so I would say, yeah, absolutely, yes, you should be only consuming organic coffee, just like every other plant related food or beverage. I would suggest to be organic. And they do use a lot of pesticides trying to grow coffee as a monocrop, but there seems to be quite an availability of organic coffee. So I would definitely recommend that. Now, mixing other things with your coffee, of course, has consequences. And the biggest thing is sugar. So when I drink coffee, it's always black. I don't want to adulterate it, and I don't want to get any, sort of digestible calories. Now, I don't want to say, I take calories seriously, but I don't want to put any carbohydrates or fats or protein into the coffee because there is nothing in there that you can digest when it's just black coffee. But, there certainly is a hierarchy of harm. And if you're putting some raw cream in there, then I don't think that it's necessarily unhealthy, but any sugar really is something that I would stay away from.
Right, and for those of you who are mentioning addictions, like we've done an episode on addictions previously, which is episode 6, which you can find in all channels, with including the YouTube channel, the Rumble channel, and Instagram and Facebook. And it also goes to the same goes for episode 3 on calories as well. Now let's go to the last question, which is something that I'd love to make a short out of. Zorro, is freeze-dried coffee safe to drink?
Well, according to the coffee experts, it is. And I think we're talking about instant coffee here, that there were no evidence of any adverse health consequences from that, although it might be better to get your own organic coffee and freeze-dry it yourself, like for camping trips or convenience.
Right. Just want to remind you guys that make sure to click the link in the description to sign up for the True Living Fellowship if you haven't already, and join us tomorrow at 12 p.m. ET during this month's masterclass of Father's Role in Pregnancy and Birth. Plus, if you'd like to attend these types of Q&As with Andy and prefer a 1-hour Q&A over a brief 5-minute Q&A during these Healthy Living live streams, we are hosting one on the 21st of May at 12 p.m. ET. Now, with that having been said, do you have any closing remarks?
Alexander, let me just bring up something about those Q&As on our True Living Fellowship platform, because we face a significant amount of censorship on these bigger platforms. For example, a blockbuster interview that I did with Tom Cowan recently talking about turpentine was taken off the channel. So inside the Q&A, I can speak freely about all the issues of natural healing and debunking all of the mainstream medical claims that would be censored. And I have to be very careful what I say, on the platforms that I'm speaking to you now.
All right. Excellent. Take care, guys. We'll see you next week.
All right. See everyone for the next Healthy Living live stream.